building on, being quite nicely set up by Maureen actually, so thank you for laying a bit of groundwork on AI and what I'm going to talk about. So, who are we? Actually, quite recently, so in the last 12 months, we've doubled in size, but we're now the largest applied AI and data science firm across Europe. So we've just over 250 employees now in the UK. Most of them are way more qualified than myself. So they're PhD data scientists and machine learning engineers. So a few of the things that have already been mentioned, all relating back to this concept of AI. We as an organisation work across kind of 4 key markets. So we work in energy, government, retail, what we're here to talk about tonight, healthcare and life sciences. Essentially what we do is we build AI systems, intelligent systems for deploying and finding value in what Pritesh kindly put as stuff that humans can't see. When we're looking at big data, what is the value there that we can't see, or it would take years and years for us to find within these data sets. As an organisation, we're partnered to several kind of government work streams, but one of the things that we did do was we were one of the strategic partners to the NHS AI Lab, and we also helped set up the NHS AI Buyer's Guide, and that comes back to only 20% of these things are actually fit for purpose. Who validates that AI? Who checks it? Who makes sure it's safe? And that's one of the things that we do. But I think it's probably worth taking a step back, because we jump into AI and what's really the value in AI. And I think we need to probably set the scene a little bit for why it's valuable to the life that we're living right now. But this is some data from Gartner, who are kind of like a consultancy company, and it's not specific to healthcare, this is just generally the life that we live right now. But we have more data than we've ever had before. Huge amounts of data from personal banking, finance, what websites you search on, all of the cookies that everyone takes, as well as all of the health data that sits within the NHS and other systems. We've actually now, in 2022, going to have 100 zettabytes of data. And to kind of contextualise that for anyone in the room who might not understand, it's around 15 terabytes, which again is a huge amount of data per person across the whole of the world's population. So it's an unfathomable amount of data. It's 10 to the power of 23 zeros. It's 50 times more data than we had in 2010, which again, like Maureen said, not too far away. We can kind of remember what 2010 looked like. But are we really making any better decisions with all of this ream of information than we are now than in 2010? Are we making 50 times better decisions about anything because we've got all of this data? Probably not. So again, from Gartner, researchers found that across industry, people actually say that all of this data is making things more complex. It's harder to make critical business decisions and healthcare decisions. How do we use this to drive improved performance? Operational, clinical, whichever. How do we augment it with humans? So if we pivot back, and again we talk about the huge pressures that our healthcare system is in, and Maureen mentioned about staffing shortages, any number of resource shortages that the NHS are facing. Those decisions that these systems have to make are critical to improving performance when we don't have enough people and we don't have enough resource beds, hospitals, social care, etc. And again, this winter the NHS is going to face a triple-demic of flu, COVID, and respiratory disease. And from various NHS trust boards, we're already lagging behind in what's deemed kind of safe performance metrics. We're waiting 22 minutes longer than anticipated for an ambulance to respond. Less than 70% of patients are being seen within 4 hours in A&E, and over 15% of all general and acute hospital beds actually occupied by patients that are medically fit for discharge. That's all data, but is it really helping us to improve anything, to get better outcomes? And again, probably quite a depressing slide, but if you work in the NHS or are familiar with the NHS, it's all about looking at data. Dashboards, Excel spreadsheets, reports. You know, one person said to us, I feel like my job is just reporting. I'm not getting to see patients anymore, I'm just having to look at data. And again, another customer that we're working with, a chief nurse, she started a new role. And for the first week, she had to look at 80 different dashboards, just looking at data. Where's the value in that? And again, it's about how do we pick out insights and value that us humans can't, but AI, data science, and machine learning potentially can. And it will augment the system so that people can still deliver the care that they need. So our kind of new approach to this, again, is based in AI and data science and machine learning, but it's building on all of this data that we've got readily available. But that's really just business intelligence. That data tells you what has happened, or if you're lucky, it might tell you what's happening right now. And again, that's quite a mature data system within, let's say, healthcare, that you can see what's happening right now. But really, to move forward in this kind of paradigm and use AI to its full potential, we need to be able to see what is going to happen in the future, and then building on the idea of not it being a black box AI and actually understanding what it's telling us. We need to understand why that's going to happen in the future. So we can move from just knowing and understanding data to actually predicting what's going to happen in the future, what's going to cause that, and then almost scenario plan, actually what are the best decisions available to me that are going to impact performance, patient outcomes best in that scenario. And the best analogy, if we've got any F1 fans in the crowd, F1 teams have been doing this for years. They basically take a situation, they model outcomes and decisions, and look into the future to see what decisions are best to improve performance. And that's really what we're trying to do here, is we're trying to use AI and machine learning to augment decision making and improve operational outcomes. So this is essentially our decision intelligence platform. And again, so in a hospital setting, going back to this kind of healthcare environment, and we're talking about really, really stretched systems and complex patient flow challenges with bottlenecks, ambulance wait times, patients waiting to be discharged. This can allow nurses, ward manager, patient flow site managers to understand what's happening right now in the hospital, but why is it happening? If there's certain demands and capacity breaches and ward over, people in corridors, but then also allow them to make decisions that look into the future to see what is the best decision. How is that going to improve, and play that forward before making that decision. Now, I won't labour this too much, but essentially how we do that is we build what is called a computational twin. Now that is essentially a software representation of all of an organisational processes interlinked, how they relate to one another, crossover, and it combines critically the human and also artificial intelligence to provide organisations with this ability, like F1 teams, to ask why, but then also to kind of go, what if? What if we do this? What if we make this decision? What's going to be the impact to make sure I'm, in my day job, making the best decision available to me at that point in time? Again, this is maybe a little bit of an insight to a kind of computational twin working behind the scenes, behind what, say, a nurse or a ward manager would be using to look at, say, patient admissions in the next 4 hours, and the breakdown into age, sex, and medical specialty. So actually I can say, well, if I free up ward space in general surgery, what's the impact going to be in 4 hours if I have a certain surgery with a certain type of patients? All of these kind of critical things that let people do their day jobs, but a little bit better and a little bit quicker. Not replacing anyone, just augmenting that ability to make good decisions. Again, this is probably a bit of a salesy slide, and I don't anticipate any of you are going to buy this off me, so don't worry. But in context, data has been a huge investment for organisations, commercially and public sector. People have spent millions on data infrastructure. But where do we derive value from just mining all of this information? We need to put in intelligent systems like AI, whether it's cardiac diagnostics or it's medical imaging. We did a lot of work with COVID in looking at national chest rate databases to augment actual COVID diagnoses, into actually finding the value and making life a little bit easier. That's what these computers can do. And kind of just quickly, I'll talk about some of the examples of work that we've done. So we built a national A&E forecasting tool, so that can forecast admissions at a hospital level 3 weeks in advance. So maybe staffing and capacity managers know how many members of staff they need to put on the rota for Wednesday next week, because for whatever reason it's a public holiday, there's a heat wave, maybe not in November or December, but there's going to be a spike in A&E. And again, they can look at the explainability as to why that is happening, what's causing those things. Bed allocation, again, very specific to people who work in hospitals, but we know that if we put a patient in a bed and we have to move them, that's detrimental to their length of stay. We need to make sure that they go to the right place at the right time, to make sure they get the right care, and they get out of the system at the right time. And again, these decisions can all, we can use AI and machine learning to make them a little bit easier. And then lastly, I thought I'd just say the one thing that you might be familiar with us as an organisation is we built the COVID early warning system for the NHS. So in 6 weeks, when no one really knew what to do as this pandemic ripped through the world and globally, we were able to build some tools that could accurately predict surges in COVID, but more critically, understand why we were having those surges, so that operationally, people could plan for ventilators, ICU capacity, and more critically, potentially, and it's been credited by the NHS as hopefully saving thousands of lives, informing lockdown decisions, because we were able to actually see the spread of disease across regions and localities. So that's a little bit about us as faculty and where we see AI, really, hopefully, not solving the healthcare crisis. That would be too strong a statement for me to make, but I definitely think it can augment our day-to-day lives and make things a little bit easier. So, thank you.